Hello, good morning and welcome to today's discussion. I am Dr. Collinsney Anna Okoti, a family physician from Ghana. I have an interest in diabetes and currently studying for the postgraduate diploma in diabetes management. Today, we are discussing a common but serious complication of diabetes. It is about diabetic nephropathy. Diabetic nephropathy is basically renal disease arising out of the complications of diabetes. It affects about 40% of the diabetic population and is a leading cause of renal failure or end-stage renal disease. What happens is that long-standing diabetes and then uncontrolled diabetes destroys the small blood vessels in the kidney, the eyes, and in other organs. The effect on the kidneys leads to chronic kidney disease, and this can progress to end-stage renal disease or renal failure. This is a rather an undesirable endpoint of diabetes. At the end-stage renal disease level, renal replacement therapy is the only means of survival. It is therefore important to, as much as possible, prevent diabetic nephropathy or delay its progression to end-stage renal disease. The purpose of this morning's discussion, therefore, is to drum home the need for early screening for diabetes, as well as its complications. This will help to identify the at-risk population for early intervention. The prevention, early detection, and management of diabetic nephropathy involves a lot of approaches by different clinicians. The treatment modalities include optimal control of glycemia, that's the blood glucose level, the blood pressure, the blood lipid, and then weight. Others are lifestyle intervention like smoking cessation, exercise, and then low alcohol consumption. The management once again involves teamwork with the patient at the center of care. The individual is expected to adhere to the lifestyle changes. Is expected to adhere to medications and then annual clinic appointments. This will ensure good control of the sugar, the BP or the blood pressure, the lipids, and then the weight. The renal dietitian comes in to assist with making good dietary choices like low salt, low cholesterol, and then low protein diets. The general practitioner, like myself, would coordinate the care with the other clinicians. He would ensure that medications that will protect the heart and then the kidneys are given to the client as early as possible. He would order regular interventions and then they give the needed advice when necessary. The renal physician or the nephrologist contributes to the interventions by slowing the progression of the disease to renal failure. He advises on the need for renal replacement therapy as and when necessary. Let's note that the two main forms of renal replacement therapy are dialysis and kidney transplant. These come into play when the kidneys can no longer perform its ability to excrete undesired substances from the body. At this stage, it is renal failure, and the management of renal failure is expensive. It involves a lot of resources, time, and energy, and it reduces the quality of life of the individual and sometimes associated with high mortality. It is therefore important to aim at prevention and slowing of progression of the disease. Before I end, I want to say that diabetic nephropathy is preventable with the needed lifestyle modification and then appropriate use of medications. Even if it occurs, the progression to end-stage renal disease can be slowed with the appropriate and timely interventions. A sure way, once again, to prevent diabetic nephropathy is optimal metabolic control. I therefore advocate for annual screening for diabetes in the at-risk population, and then annual screening for diabetic nephropathy in the diabetic population. This is a sure way to identify the condition as early as possible and then institute the necessary interventions. Thank you very much for your audience, and I wish you a good day. Bye.